Good afternoon, sir. As we have been discussing that in these COVID times, we are a lot of the dentists are looking forward to some guidelines which can actually assist them and guide them in making better decisions. And I mean, there are a couple of questions that I've enlisted, and I'll begin with the first one. That when can dentists actually start practicing? Would this be a right time or not? And and is the right time different for every practicing dentist? How is it?
Yeah, so great question, Paritosh. And as you know, many of our colleagues have already been practicing. Um, health and dental are essential services which were exempt from most of the lockdowns. And a lot of them, I've been hearing a lot of discussions with some of my colleagues, my classmates from back in college. A lot of them have been practicing. Also, they've been only taking on emergency cases mostly. So the general practice has been slightly slow, but emergency practices have been on. I think the most important thing is, like any other essential service and the ethics of dental practice state that we can't refuse any patient. So the objective is to take a lot of care, be very, very careful about, doing the temperature check, doing a pre-check, ensuring that they've, taken the, making it mandatory for using the Arogya Setu app for the patients, for example, having a disposable set of gowns and suits so that there's very less chance of contamination while treating the patient. Of course, taking care of your own well-being and wearing a hazmat suit, wearing a face shield, limiting the aerota use, because aerota spray is probably the most dangerous thing right now, as you may know, because it's a droplet infection. So these are the precautions you should normally take. And if the patient is showing no symptoms, and if you have taken the precaution, then hopefully, you will avoid any chances of infection during this time. Hope that helps.
Okay.